All right, I call to order the January 4th, 2021 special called board meeting. Would everyone rise for the Pledge of Allegiance, please? I pledge allegiance to the flag, United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. All right, welcome everybody to this highly anticipated meeting. Hopefully everybody out there can hear us. I know that you can't see us today because we are doing this meeting remotely. First up is going to be the agenda approval. I will accept a motion when someone's ready. Please make sure that you unmute yourselves when you get ready to talk.
I move we approve the agenda as presented.
And that was Amy Lynn Holt. Do I have a second?
Second.
Second, I heard Mr. Bridges. Ms. Case, yes or no agenda?
Yes.
Mr. Egoff?
Yes.
Dr. Revis?
Yes.
Ms. Caskey?
Yes.
Ms. Holt?
Yes.
Mr. Bridges?
Yes.
And I'm a yes myself. All right, so we have everyone here. We also have our leadership team with us today, along with our council. We're going to go ahead and get right into this, what everybody's waiting for. Return to Learn plan update. Dr. John Bryant, take it away.
Thank you, members of the board and Mr. Craven. Appreciate the opportunity to share with you what we have here today. This slide deck is very similar to what we have presented in the months past as it relates to our Return to Learn. It begins with local health information, and we have shared with you at each of our most recent board meetings this information as it relates to the Harvard Global Health Institute and that daily cases per 100,000. Next slide, Mr. McMurray. This demonstrates the trend that we have seen not just locally, but across the state and across the country, as the cases have begun to spike significantly in our community and areas around our community. You'll note that that spike occurred following the Thanksgiving holiday. We were witness to that in our schools as we closed out the 2020 school year in December. But the numbers that you see peaking most recently all the way into the most recent data that's being reported as of January the 2nd is 95. That 7-day rolling average is 95 per 100,000. And so we've seen significant impact locally and significant impact across our region as it relates to the trend data associated with our monitoring of this. Next slide, please. Additionally, the North Carolina Department of Health and Human Services publishes the County Alert System report that this board is familiar with. It's another one of the data points that we monitor. This is the slide as of December the 8th. You'll notice at that time, Henderson County was in a significant or the yellow tier with a 14-day case rate at 326.2 and a positivity rate that was hovering around 5%. Next slide, please. As published in late December, December 22nd, Henderson County's tier changed to the critical or the red area, noting now the positivity rate being above 13%. We're fortunate that the column that notes hospital impact is still noting low, but we know that our local healthcare providers are seeing the surge. Several of them noted in the December information that was published from our healthcare providers, the surge that many people expected to see in March showed itself after the Thanksgiving holiday going into Christmas, and we can expect that that trend information will continue. Next slide, please. You'll see again, this is just a close-up of that specific nature as it relates to Henderson County being in the critical or the red area, and that tier being a positivity rate in excess of 13%. Next slide, please. Ultimately, what does that mean for us as a school system? We know that at the end of December, we saw critical staffing shortages across our school system. We began reporting a significant number of COVID positive school affected cases. as well as quarantines that affected our staffing, our students, and our entire school communities. And so with that in mind, as we look to that trend data doubling, tripling, and even quadrupling in many areas, it is the recommendation of the leadership team to the Board of Education today that we recommend starting the new year on January the 7th under Plan C, or a fully remote option for all students. That recommendation would mirror Plan C for Henderson County Public Schools as we began the school year in August of 2020, where we would have synchronous remote instruction for all of our students, K through 12, from 8 o'clock in the morning until 12 o'clock in the afternoon, that we would continue with independent support for students in the afternoon sessions, and that our grading and our attendance practices would look similarly to they do with our in-person expectations, as our students and our staff demonstrated at the start of the school year all the way through our transition into Plan B. Next slide, please. This particular slide just is the re-overview of the schedule of what Plan C means for Henderson County. Again, when we operated under Plan C in August and early September, our K-5 students were served via remote learning from 8 until 12, following the individual classroom teacher's schedule. As we think about starting the school year that way, teachers, if that schedule has changed, would communicate that change in classroom schedule to their children and their families. Grade 6 through 12 remote learning as well would occur from 8 until 12, and then would follow the school's in-day or the in-person half-day bell schedule. Once again, you'll note in the box at the bottom of this slide, board members, that the afternoons will be used and continue to be used for individual and small group virtual support and enrichment, continuing to create opportunities where we can connect with our students as it relates to that. Next slide, please. From a community support standpoint, this recommendation under Plan C acknowledges the critical need to provide childcare services where they can be offered at select school locations as is needed in our community, and specifically the prioritization being made for healthcare workers, frontline first responders, and other essential workers in our community, as well as those families that most rely on the childcare services for our kindergarten through grade 5 students. Our child nutrition services would continue, and they would be modeled once again, just as they were during our Plan C operations in August and September. The grab-and-go meal sites would be available at schools, that we would provide meals on the bus at community sites where they would travel to community areas that would greatly benefit from that direct meal service. And many of our schools, our social workers, our school counselors, and our teachers also provided home delivery for meals services as needed and as requested for families that were unable to access that in that place. Now, I'd pause at this moment for just one second to share with you that this recommendation comes with the full recognition of the challenges that are associated with Plan C, but also the full awareness of the trends that our community is experiencing as it relates to critical health concern. When it comes down to taking care of our staff, taking care of our school communities, and taking care of our students, we have to factor all of those elements into play. And I would emphasize again that in December, especially late December, Henderson County Public Schools felt the full force of this trend data as it related to our ability to safely operate, to serve students, to supervise students, and to provide that instruction. And we have only seen that trend data increase exponentially. And with that in mind, it is our firm belief that the safest operation for the school system, while challenging for all of us, the safest operation for the school system is in a fully remote environment. That takes into consideration the manner in which we can serve our students, we can protect our staff, and we can be part of helping to stabilize community health. That's no easy lift as it was in August and September, but we recognize that, again, we want to be part of stabilizing community health in that work. I'd like to pause for a moment, Mr. Craven, if you don't mind, before we move to the next slide, just to make sure if there are questions about what this recommendation encapsulates, that we address those and answer those for the board right now, or offer any further context about what Plan C was back in August and September, because our newly elected board members in December may want some clarifications about those expectations.
Board members, let me remind you, before you do talk, just make sure that you are stating your name so that the public does know who is talking. So with that, does anybody have any questions or anything to say?
I do. This is Amy Lynn Holt, and the question I have is, I know back in August and September, we were having a problem with getting hotspots out. Have we, I know it was a backorder issue, not the fact that, we just weren't getting them. Have we been able to rectify any of that?
I'm going to turn that over to Mr. Fender. Mr. Fender, do you mind responding on that one, sir?
Yes, Ms. Holt, we have provided hotspots to everyone now that has requested them. And in addition, we still have nearly 1,000 hotspots ready to go if needed.
Awesome. Thank you, Mr. Fender. Anybody else have any questions?
I do.
Okay.
Stacy Caskey. Will our teachers be allowed to work from home, as we want to minimize, obviously, the contact within the schools as well?
I'll let Mr. Rhodes add a little bit more to this, Ms. Caskey, but as it relates to our expectations for staff, under Plan C in August and September, we had a structure by which staff who found themselves in a high-risk category are eligible for a work from home. There was a categorical eligibility there. We provided that. Otherwise, our expectation was that staff would report to their classroom to deliver that instruction in order that they have the full resources of our school facilities, our internet, the stability associated with our internet, and the ability to deliver that. Absent the need to interact with staff when the school buildings were shut down under C, they can adhere to the guidelines for school safety and individual safety on that. Mr. Rhodes, would you like to add anything to that?
No, the only thing, Dr. Brown, that I would add is that not only for the person who may be high risk, but also anyone that they live within their household, if they have someone that is considered high risk, then they could apply to work from home as well, and we're approved.
Thank you. Anyone else with any other questions?
Hey,
Mr. Goff?
Yeah, thanks, Blair. Jay Egoff, I missed, how long would we go on Plan C?
We had not yet touched on that, Mr. Egolf. Thank you for that. As we move to the next series of slides,
Okay,
it would
thank
outline.
you.
Yes, sir, no problem. That would outline for us, this recommendation would be to operate under Plan C for at least 1 month. That would be through January 31st, and we would continue to evaluate the community health trends moving forward from there.
This is Blair Craven. I have one question for you, Dr. Bryant, as it relates to the child care services. Healthcare workers, frontline first responders, and essential workers are who are going to be prioritized for the child care. Do teachers that are working in the school building, do their children count as essential worker employees or children, I guess?
Based on the revised guidance from the CDC as it relates to frontline essential workers, they would, yes, sir. So they would be prioritized. Again, this is still a full pay service and a registration service for the child care that would be offered. It's not being offered free of charge to these groups for our programs. But based on the revised guidance that while we'll touch on a little bit later as it relates to the vaccination, essential frontline workers, educators are categorized in that group, Mr. Craven.
Thank you. Anyone else before we move on?
I have an additional question. This is Amy Lynn Holt. What does this do as far as athletics? Are we pausing those as well?
Right now, Mrs. Holt, athletics is a voluntary activity with no revised or changed guidance from the Department of Health and Human Services or the North Carolina High School Athletic Association. You remember during Plan C, we had voluntary team activities that were occurring prior to the start of those athletic seasons. So this Plan C operation would not suspend athletic operations unless the guidance from the North Carolina High School Athletic Association or DHHS changed.
Great. If there's no other questions, let's go ahead and move to the next slide.
Yes, sir. Next slide, please, Mr. McMurray. This particular slide talks a little bit about one of the most significant elements as it relates to our operations moving forward, and that is the vaccination planning and rollout. Specifically, the graphic that you see here is provided by the Department of Health and Human Services, as well as that which has been published by the Henderson County Department of Public Health, specifically identifies how the vaccination plan tiers have been adjusted by some revised guidance from the Center for Disease Control. And specifically, I draw your attention to that second box, which is 1B. 1B identifies the second tier of vaccination planning to be targeted around adults who are 75 years or older and frontline essential workers. And much as the way Mr. Craven just mentioned, frontline essential workers now includes a large group of people. And so as 1A is being completed, 1A specifically being frontline healthcare, frontline first responders, we think about making sure we take care of the men and women that work in our hospitals, the men and women that drive our ambulances, the men and women that serve in fire and rescue and law enforcement. They're 1A groups. Next slide, please, Mr. McMurray. This details what the CDC means when they say, who are the tiers or group 1, group 2, group 3 of phase 1B? Specifically, again, when the local health department determines that we can move to phase 1B, and that is a local decision, that determination would first target anyone 75 years or older, regardless of health status or where they might be living. Group 2, healthcare workers and frontline essential workers, 50 years and older. And I'm going to ask Mr. McMurray to click to the next slide for just 1 second, because I want to highlight the specific language. You can see that when you talk about who are frontline essential workers, we have correction officers, food and agricultural, U.S. Post Office, manufacturing, grocery store, public transit, and those who work in the education sector. That's teachers, support staff members, as well as childcare workers. And so based on this revised guidance, I think it's important for us to articulate one of the most frequent questions that's being asked, and that is related to where do educators fall in this group? And so as Henderson County transitions to 1B and then group 2 of 1B, educators would be part of that consideration. And then after 50 years and older for that group, group 3 is this frontline essential worker of any age. And that would capture all Henderson County Public Schools employees, regardless of status. The way we've defined that internally is essentially if we have issued you a badge, you are eligible under that category. And you would be eligible to voluntarily be part of the vaccination effort should you choose to do so. Before I go to the next slide, Mr. Craven, I would like to answer any questions that the board might have specifically about this revised guidance from the CDC, the information as it relates to DHHS, or how this might impact the school system moving forward.
Any questions from anyone regarding this vaccination schedule?
I have one. This is Kathy Revis. Dr. Bryant, do you have any idea the time frame when our educators, teachers, and support staff members may get the vaccine?
Dr. Revis, those timelines came with some recommended dates associated from the Department of Health and Human Services. In my conversations with Steve Smith, of course, that transition is really going to be dependent on completing 1A first. So as we're learning in every area of the state and the nation, the vaccination effort is happening at different speeds. What we do know is we're making the plans to, as soon as we can transition to that, and we would expect that that transition could occur as early as this month, that we would be prepared to transition to it as soon as they were ready.
Dr. Bryant, Robert Bridges here.
Yes, sir.
When vaccinations do begin, will the health department come to our schools to administer those?
We are just beginning the initial stages of our planning. Mr. Taylor, in his service as the Chief Administrative Officer, is going to be coordinating our effort alongside the health department and our local healthcare partners, Mr. Bridges. It is possible that those will be administered at school sites. It's possible that they would be administered elsewhere, but we are going to work in concert in lockstep with our healthcare providers and our partners about what is the most efficient, successful, and safe way to ensure that everybody who wants to participate in the vaccination effort is able to do so.
All right, thank you. Any other questions? All right, Dr. Bryant.
Thank you, Mr. Craven. Next slide, please. We do get questions right now about students. I think it's important to understand where students fall into the vaccination planning as recommended by DHHS. They are considered phase 3. College and university students would be on that top list. And then K-12, it's age 16 and over. I have received this question frequently about when would kids be eligible. Again, I think it's important to understand that the current vaccinations that are available are not designed or approved for children under the age of 16. And so if and when we get to phase 3, then Henderson County Public School students who are age 16 and over would be eligible under phase 3. So we have 1A, 1B, phase 2, and then phase 3 whenever it would be determined. Next slide, please. In order that we touch on what happens next in this category, again, based on the board's approval today with the recommendations, we would be immediately reviewing these plan components again with our school leaders and staff groups. We would publish those plans just as we did in August for our parents and our families. As I mentioned before, we would be establishing and finalizing the logistics for our vaccination efforts. We would provide updated guidance and clarifications as they continue to come out. And that CDC revision is a perfect example of that, moving educators to what are considered frontline essential workers. We would be providing guidance to employees per Ms. Caskey's question about those who consider themselves to be high risk and making sure that we are caring for the safety of our staff and understanding that they are critically important in terms of our care decisions. We'd be training school leaders and staff groups on any updated safety procedures. The next to last bullet does articulate, we paused the COVID dashboard reporting over the holiday. And there was a reason for that, because we are reporting school affected cases, and with schools not open or people attending them, we'd pause that. We would continue that pause on reporting because students would not be attending in-person sessions there. And so until we transition back to B or A in any school environment, our COVID dashboard reporting and those calls directly to school communities would be put on pause. We would continue to track the data as we continue to receive it over the holidays. So we would have that as internal information, but we would not be providing the alert calls or posting on a daily basis to the dashboard. And then finally, we would be remaining flexible in our logistical planning for our future instructional service as we talk about how to transition back to in-person learning. Next slide, please. How we'd start the year, Plan C. Again, this is fully remote learning for all students beginning Thursday, January the 7th. We would continue, as we have done throughout this period, to monitor the health trends and our workforce stability. And I do emphasize that part, as this board is well aware, when it comes down to making sure that we can safely supervise, serve, and instruct students. That is a critical piece of our school system operations. We'd continue our district communications, weekly communications to families as part of our R2L updates. We would set the goal of transitioning back to Plan B, that is in-person instruction, on February 1st. We would prepare as well, as we said in our December meeting, to make every effort to bring back our 4th and 5th grade students under Plan A in February for those parents and families that would want to choose so. And we would acknowledge in that last bullet that that implementation does change the conditions of what Plan B looked like in our elementary schools in the new year. I'll pause here for just one moment before we talk about our summary thoughts, if there are any questions for members of the leadership team or about this particular slide.
Anybody have questions?
I do. This is Amy Lynn Holt. Since we are not publishing the data on how our school communities are affected, how are you just going to let us know before the next meeting what these numbers are so that we know how it's affecting our schools? And do you know now, like, how many of our staff is in quarantine? They're not due to report back to work yet, so I don't know if they've reported that in.
Yes, ma'am. That quarantine number, Ms. Holt, is the hardest one to track. I will tell you that we did receive all of the notifications regarding COVID positive tests for staff over the holiday break, and we know that we had a handful of those. Yes, we will continue to, as I said, track that internally so that we can share that with the board in our updated board meetings. You think about January the 11th, and then potentially as we get closer to February. The quarantining one is one that we may only know the full impact of when people are scheduled to actually return to work, because their official return date, of course, is Wednesday of this week as employees. But it's one of the ones that we pay the most attention to. And as this board knows, it was the one that most significantly impacted us in late December. In late December, the notifications that we were making, as well as the determinations to have to close 3 of our schools those last couple of days, was directly related to workforce issues and people who were unable to report to work based on a direction that they had received or determined to be a close contact. So as we see community health continuing to trend in this sort of exponential way, one of the things that we'll have to do, even in a fully remote environment, is pay very close attention to our workforce stability. And so to kind of go back to Ms. Caskey's question, and Mr. Rhodes can speak more to this, if someone is directed to quarantine by the health department, but then has the capacity to be able to work from home, that is a permissible place to do so at that point. And so we follow the health department's guidelines and still provide instruction at that same time. And so that's one of those places where eligibility is appropriate.
Blair, John or Scott, if a teacher has those existing circumstances at their home, go over again how they come to you guys or how they get permission to teach from home.
Mr. Rhodes.
Thank you, Ms. Case. Ms. Case, we'll be sending out guidance once again like we did in August, reminding teachers that they can go onto our website, get that information. They'll be able to fill out those forms, turn it into the HR department, along with the proper documentation from their healthcare provider. And then we are approving those folks to be able to work from home. We're also, anyone that was already pre-approved in August, they are automatically approved. They do not need to reapply. So hopefully that will help that issue as well.
Okay, thank you.
Anyone else have a question on this? Just to recap, Dr. Bryant, just to make sure that we understand correctly and everyone listening understands correctly, your wish is for us to go to Plan C for all students beginning this Thursday, January 7th. And we have a goal of transitioning back to Plan B on February 1st, which is a little over 3 weeks away. And also on February 1st, we would be looking to bring back all of our 4th and 5th grade students that want to come in person along with K through 3 at that time. Is that correct?
Yes, sir, that's correct.
All right. Does anybody have questions about the reasons why or anything of that nature? All right, Matthew, next slide, I guess.
Thank you, Mr. Craven. And then again, the summary thoughts, these are 4 bullets that you all have become very familiar with, and I think are critically important for us to remind our community and each other that these recommendations and the plans will continue to be fluid, and they are contingent on our local health data, the stabilization of our local health data, our local health data trends, and the safest decisions possible for our staff, for our students, and for our greater school communities. We are and continue to remain in absolute close coordination with the Henderson County Department of Public Health and our partner healthcare agencies. We will continue to be responsive to direction from the Department of Public Instruction, DHHS, the regular announcements from that governing body and other state governing bodies. And then we will be making every effort, the tireless effort, the extraordinary effort of our teaching staff to continue to meet the instructional obligations of our students every day. But those are our summary thoughts, Mr. Craven. And again, at this time, I'd be glad to answer any questions that we might have. That is our final slide, sir.
All right, thank you. I don't really have any questions. I've got a couple of comments I'd like to go ahead and get out there. Would everybody push mute real quick? There you go. As someone with 3 kids in the system, you know, I don't like this. My kids are doing very, very well, especially my littles, going to school every day. We know that kids need to be in school every day, but I think it simply boils down to one thing right now. is that the last week of school, we had to shut down 3 schools because we didn't have enough staff and teachers to take care of the kids that were there. They were struggling to even cover people that were out. We probably could have shut down 3 or 4 more schools easily based on the numbers that were out there. And although I don't like it, I think this is the most appropriate decision to make. I really like the fact that we're going to bring back our 4th and 5th graders full time for those that want to come back full time February 1st. I think we need to continue to look at the data and make sure that we have accurate numbers in the coming weeks as it relates to number of teachers that are quarantined or are positive and cannot be in the building, as well as substitutes and what we can do in that area to safely hold school to make sure that February 1st we can come back and we can stay in school like we did the first semester. That was one of the main goals, is that we don't start, stop, because I think that's a lot more disruptive than starting virtually and then bringing everyone back. So again, I don't like it, but I understand it. I think it has to be done, and yeah, those are my thoughts on this. Does anybody else, would you like to share any thoughts? Any other board members?
We got Robert Bridges here. We got positive feedback from our community and teachers this past couple of days. Many of them were stressing the importance of Plan C.
I want it to be said so the public knows that we did not read all the 65 letters I got, and everybody else probably got similar amounts, but I do read every word of those letters, and I think everybody on the board does. So I want that to go out to the public, that they did not waste their time letting us know how the community feels and how the teachers feel about what's going on.
Thank you, Ms. Kate.
Absolutely. Yeah, I was glad to hear from them too, and I read them all also myself.
No, I think that's a good point. We do receive, I'd say, in the hundreds of emails in the last couple of days. We do read them all. There is a reason that we don't take public comment on the special called board meetings. We will take public comment at our regularly scheduled board meeting. I believe that's next Monday. And so you will be able to submit those comments for public record then, but we do get your emails, we do read them, and thank you for everyone sending those. Would anybody else like to say anything?
Yes, this is Amy Lynn Holt. I have a comment and a question. So one of the big leaders that we have leaned on the past several months has been the health department and the medical community, because this is not an educational issue per se. I mean, it's causing it to be one, but it's a medical issue. Is it, and I know that when we talked with Steve Smith back several weeks ago, our cases weren't like they are now, and he was comfortable with us staying in. Has the view of the health department changed in the past couple of weeks? Because I'm having a real issue. I understand the need for it, but I'm having a real issue, especially with our kindergarten, 1st and 2nd graders, not allowing them to come back, because I know basically, they're not going to get much out of virtual school at all. So I have a real issue agreeing to the plan. However, if this is what our health leaders want for us to do, I definitely would support that.
Ms. Holt, I think, we share that level of concern, and what I can offer is Steve Smith is kind enough to still answer the phone every time I call, and we are in regular dialogue. We have shared this recommendation with the health department, and I think I can say with absolute certainty, Mr. Smith and the health department share our level of concern about the safety of our school environments and the safety of our staff in our schools as it relates to this operation, and recognizes the very prudent nature of this decision. As Mr. Craven said, it is a very difficult one to make. I think I could even say on behalf of all of our teaching staff, no one wants kids back more than our teachers do, and at the same time recognizes how critically the direction of our local health is trending, and we cannot ignore that. And so that is a shared perspective by the health department and full recognition that community health right now is about everybody doing everything that we can do to try to stabilize that.
Stott case, several of the letters we got said that the CDC, the White House COVID Task Force, and the Harvard Global Institute numbers, and it said that they all said enable remote learning for all students. So we were going by Harvard before we got to this point. So, you know, if that all those groups are saying that we need to be remote, it seems to me, wow.
I have a couple comments. Jay Egolf here. I was on the. First of all, I do agree with the recommendation by the administration, but I do want to. I did some research on the CDC on. And I know I don't like talking about this, but it's death rates. The death rates at the beginning of November were higher than at the end of December. So I know everybody looks at positive cases, and that's fine. I look at deaths. I'm sorry, but that's what I look at. I've had it. My wife has had it. Our parents have had it. Both sets of parents have had it. A couple people here at work have had it. You know, I think it's going around. I think a lot of people get it and don't die. Some people do get it and die, but that's what I look at. I don't look at positive cases. I think everybody's going to get it. Not everybody, but a lot of people are going to get it, unfortunately. But one thing that really kind of bothered me a little bit was on all these letters, and I appreciated everybody writing in, but it seemed to be that they were focused on the teachers and the staff, which is fine, but I have 3 kids in school, and I hope I'm not gonna get emotional because sometimes I do, but I have 3 kids in public schools. There was not many of the letters focused on the lack of quality of education, of what these kids are gonna miss, especially K through 5. I mean, you just don't know how bad this is gonna be, and we're not only this is not just a 1 month of C and a 1 year of C. This is a year and a half that there is going to be set behind. And it's almost like, you know what, I went to Carolina and it took me 4.5 years. You know, if it takes someone 18 and a half or 19 years to finish high school, then let it be. Why don't you just call off the whole school year? No pay, no benefits, no school. Just cut it out. And get everybody better and then come back to school. That's how I almost feel. Just put the whole thing on pause, let everybody start graduating at 18 and a half. I know that that's not a possibility. I just think going back to a month, I think a month is too long. I do look at, when I looked at the death rates and the positive cases, they did spike 2 weeks after Thanksgiving, and I do believe they will spike after December. But if that's what the board feels we need to take off the whole month of January, you know, I'll go with it. I think in the future we need to, in my mind, I am not. It's just going to be what the governor says and what staff we have. That's all it's going to be. I mean, like I said, 3 kids, and I can see what this is doing, and I know what this is doing. And this is not just my kids. This is a lot of kids out there. And you know, if the governor says we can be K through 5, then you know, by God, I say we can be K through 5. Now we don't have enough staff. That's fine. But I'm just letting the board know. I'm letting the public know. That's where I stand, and that's where I'm going to stand to the day I'm off the board. You know, the kids need to be in school. This is terrible for their education. Now, there always does need to be a virtual option. I mean, I'm not saying that, you know, I think from now on, we need to figure out how to always provide a virtual option. There can be people for whatever reason will always want to go virtually. That's fine. You know, we need to have virtual teachers. We need to have virtual classrooms. We need to always be able to have a Henderson County public education virtually. So that's fine. But I don't like when the parents come in and say, take away the in-person choice. You need to have both. You need to have an in-person and virtual. You know, I saw today, you know, Greenville County is back in. I don't know, Greenville County is not Henderson County, you know, and it's whether it's bigger or smaller or more or less or whatever. I do know that there are other places doing different things. So anyway, I'll sum up. I know I've taken way too long a time, but you know, that's the way I feel. I feel 2 weeks is too long, but I'll go with it. But I'm telling you what, February 1st, and for the rest of these meetings and votes and everything, I mean, the kids have got to be in school. That's the way I'm going. And I don't care what any board member tells me, any public tells me or writes me. I can see the damage we're causing, and they need to be back in school.
Thank you, Mr. Egoff. Anyone else?
Yes, I also read the hundreds of emails that came in. And I think there's a big disconnect. First of all, there are some teachers who are very skeptical about the contact tracing. And I'm sure we all read some of these emails where a parent had COVID and the student was not symptomatic. They never had them tested. They sent that child into school. Well, that wouldn't be considered a close contact. And meanwhile, we have teachers who are home with their entire families with COVID at this point. I just don't feel that our teachers are expendable. And I think that for school to occur, everybody has to be considered in this. And it's not that we know best education practices are having our kids in person, but this is a once in a lifetime situation. And I think we have to put public health, you know, ahead of everything and just try to do the best we can with virtual learning. I mean, I have felt that the virtual learning has been excellent. I mean, that's been our experience. And we know our teachers will work as hard as possible to make this as best an educational experience as we can. My only concern, to be honest with you, is not giving teachers the choice of if they want to, you know, to me, if you have reliable internet at home and you have your resources at home, why are we putting a situation in where we're actually maximizing the danger by having more people in a building? I know that you're saying special circumstances will be exempt from coming in, but our teachers are professionals. I'm not really sure why they can't work from home. I think most would choose to come in anyway, because it is easier to have all of your belongings there. But, you know, we have insurance agents working from home and stockbrokers and attorneys and telemed. It just seems that, you know, our teachers are professionals. So I think we should give them the choice of coming in or working from home. Thank you.
Thank you, Mrs. Caskey. Dr. Evans?
Yes, I just want to say that I as well read all of the emails and try to acknowledge them. And parents, my heart goes out to you. I understand the issue and that many of you are workers that have to leave their home to work. You're not allowed to work remotely. And I understand that, and I understand the daycare issue that causes. I also understand, by having 3 grandchildren, that parents have to depend on other people for childcare and other resources. And I understand that. And I understand that some children, particularly with disabilities or ADD issues, find it very hard to do remote learning all the time. What we're talking about here, however, is 9 face-to-face class meetings that our grades 4 through 12 children are going to miss. And when we look at the big picture has to be, I'm willing to sacrifice those 9 face-to-face meetings that our grades 4 through 12 children are going to miss in order to maintain the safety and the health of our staff and our students. And so I do support this recommendation. I think we can get emotional about things all day long, but we have to let the numbers and the data and the statistics guide our decision. I do appreciate parents acknowledging the importance of that face-to-face instruction, and there is no substitute for that. I understand that. But I think we have to step back and look at the big picture. And I do want us to get back face to face, all of our students, as soon as possible. But I think we'll only do that if we take a pause right now and step back and go remotely. So I do support the leadership team's recommendation.
Thank you, Dr. Revin.
Robert Bridges here.
Yes, sir. Go ahead.
We didn't ask for this virus to affect our school systems, but we have to deal with it as best we can. And I would like to compliment our administration for trying their best to meet the needs of not only our parents, our staff, our administration, our teachers, and our children, but we have to make the best decisions that we know how to decide what to do and for the benefit of all our community. Like I say, we didn't ask for this virus. It was put on us, so we have to deal with it. There are no answers that are exactly correct. So we have to go with the flow. We have to make our best decisions that we know how. And again, I would like to commend our administration, our school system. It's one of the best in the states as far as I'm concerned. And we're faced with this dilemma, and we have to deal with it as best we can. And I think our administration is doing the best job they know to do in dealing with this virus that has brought on all these problems in our school system. Thank you.
Thank you, Mr. Bridges. One thing I did want to put up there, Dr. Revis, is that it's actually 16 days that kids would be missing for K through 3, about 7 for our AB schedules. So we are Martin Luther King Day, I believe, is the 18th, and we do take that day off, but the rest of the month would be virtual for everyone else. Do we have any other comments? I think everyone said their piece. Any more questions, comments, concerns? Okay. I know the parents are not going to be thrilled with this decision. A lot of parents, I mean, I'm receiving the emails right now. I'm sure you guys are as well. Like I stated before, I'm going to have to sit beside my kindergartner and help him navigate for the next month, but I think it is for the greater good. And it is my wish to go ahead and get everybody on record right now as to approve this leadership request to go to Plan C until February 1st, which at that time we will be bringing back K through 5 full time, pending any other data that comes out. Also, we have a meeting next Monday, and we have a tentative meeting for January 25th in case that data does not look as good as we hoped. So I'll go ahead and I will
Blair?
start. Yes, sir.
JE Golf. Before we vote, tell me, I want to know how to vote, because I want to vote for 2 weeks, but I also don't want to vote for something that's impossible. I mean, it's the planning, teacher planning, and the staff planning, and the administration, everything. Does that just make 2 weeks impossible?
I think you can vote any way that you want to. This is a recommendation that came from our leadership staff. Any one of our board members are able to make a motion at any point in time. Then if there's a second, we'll have a vote after some discussion. And so at this time, I will accept a motion, whatever you got.
Robert Bridges here.
Yes, sir.
I would like to make a motion that we go fully remote, Schedule C, beginning January 7th and ending January 31st.
All right. Do I have a second?
A second.
All right.
A
Dr.
second.
Case was the second. Do I have any discussion? If there's no discussion, I'm going to call for a roll call. Mrs. Caskey, yes or no?
Yes. Yes.
Mrs. Case, yes or no?
Yes.
Mrs. Holt, yes or no?
Yes, for 2 weeks.
Well, that's
So the
not. the mo-
31st.
That's not the motion. The motion's until.
No, I
the-
mean until the 31st.
Until the 31st, okay. So you're a yes for this motion.
Yes, sir.
All right, Mr. Bridges,
Yes,
Dr. Revis,
Yes.
and Mr. Egoff.
Yes.
I'm a yes as well. Leadership staff, you have your marching orders. We are now Plan C from now until the start of February 1st. Like I said before, we're going to have another meeting next Monday, which is our regularly scheduled board meeting. All parents and staff are welcome to submit their comments online. Those should open up, I believe, tomorrow. We should be able to send those in. And then keep the 25th on your calendar in case that we need to come back in between our regularly scheduled board meeting in February 1st. If we need to make any changes to what we just approved. If there are no other questions, comments, or concerns, I appreciate you all being here today. No questions?
We need a motion to close.
All right, I'll take a motion to adjourn.
I move we adjourn. Amy Lynn Holt.
Do I have a second?
Kathy Revis, second.
All right, roll call one more time. Ms. Caskey, yes or no, adjourn.
Yes.
Ms. Case,
Yes.
Ms. Holt,
Yes.
Mr. Bridges,
yes.
Dr. Revis,
Yes.
Mr. Egoff,
Yes.